more tools and education are helpful, but I think it behooves policymakers to be thinking about ways to simplify that. You shouldn't need an advanced degree in health policy to know how to use your healthcare plan.
You're listening to HMA's Vital Viewpoints on Healthcare. Let's get started. Today's conversation focuses on one of the most complex challenges facing states and the federal government alike: how to ensure a more seamless and affordable health insurance system. Joining me today is my colleague, Zach Sherman, a leader who has been at the center of this issue, shaping Affordable Care Act marketplace policy and strategy as the marketplace director in 2 different states, Pennsylvania and Rhode Island. Zach is a managing director at Health Management Associates, where he has focused his work on improving access to and affordability of health insurance across all programs. Together, we'll examine the warning signs emerging across the coverage landscape, where the biggest affordability and access gaps remain, and what policymakers, states, and healthcare leaders should be watching and doing as the next phase of Medicaid marketplace and employer-sponsored coverage takes shape. So, Zach, welcome.
Thanks, Jen. Thanks so much for the opportunity to be here.
This past year and a half, the Affordable Care Act has really been in the headlines, ACA marketplaces, way more than I think. We had a reprieve for a while, and they were certainly back in the headlines this past year. So lots of disruption of coverage. So when we think about who is in the marketplace, we know that the marketplace was originally set up, the Affordable Care Act was originally set up to fix gaps. And there's a segment of people who do tend to bounce back and forth between maybe Medicaid, employer-sponsored coverage, they were uninsured, and the marketplaces, I think, filled that gap. So as all of these programs shift, talk a little bit about the conundrum. I mean, it's like trying to, plug different holes at the same time. What's the conundrum really that states face in trying to fix this seemingly still somewhat broken part of the health insurance market?
The creation of the ACA marketplaces came about trying to address lack of access to affordable health insurance for a large group of Americans who couldn't get it through their employer or through public health care programs like Medicaid or Medicare. The uninsured rate prior to the ACA coming into existence was much higher than it is today, something like 15%. And a lot of the people who were uninsured were those who couldn't get it through public assistance programs like Medicaid or through their employer. They didn't have access to employer coverage. And importantly, we saw a pretty big dip in the uninsured rate through people coming into the individual market and enrolling in coverage, as well as the expanded category of Medicaid for childless adults that came about as a part of the ACA as well. So there's been many trials and tribulations with the ACA with marketplace coverage since then, since 2014, but we've seen a lot more people get covered. And in 2021, with the American Rescue Plan, there was a real need for trying to address coverage gaps and the impact of COVID, which created a real fear that people are going to lose employer coverage. So the American Rescue Plan expanded the availability and the value of those tax credits and really increased the number of people enrolled through marketplaces. I think enrollment growth from 2020 to 2025 with those enhanced subsidies grew from 12 million in 2020 up to nearly 25 million. Depending on your situation, you could be enrolling in Medicaid, you could be getting coverage through your employer, you could be getting coverage through the marketplaces. Things change. When circumstances change for consumers, they may have to change up and navigate to another program. And the ability to do that is not simple. And it's something that requires a lot of upkeep and maintenance and attention.
I mean, let's put affordability aside because I want to come back to that, of course, because we know that's a huge issue. All right, you mentioned increased subsidies, increased enrollment. So obviously affordability matters. But what else have states learned? I mean, you talked about sort of the complexity. There was an individual market before the ACA came along and it didn't work really well. And so do you think that we've learned other lessons about how individuals seek insurance? Again, affordability aside, because we know it's a huge issue, but beyond that, what else have we learned about how to get people to, to enroll and then to stay enrolled?
For a lot of the consumers who enrolled in coverage for the first time through the marketplaces, there's been a real learning curve, whether you're accessing a regular primary care visit or going to the emergency room or paying for a prescription. How the health insurance pays for that and what your obligation is not easy. It is not straightforward. And I think that we've seen, particularly with the marketplaces, people buying just based on their monthly premium, people purchasing plans specific to what you can afford on a day-to-day basis. And of course, the challenge with that is that everyone has different healthcare needs, and how their overall total cost of care and coverage plays out is specific to how many healthcare, the types of healthcare services that they need throughout the year. It's really hard to predict what that will be, particularly the unknown services, the potentially catastrophic or the unknown illnesses. But generally speaking, understanding how a health insurance plan is going to be the best tool for providing access to care is something that is a steeply learning curve, like I said, and something that requires a whole lot of education and support. So through the history of the ACA, which is very short to date, it's only, just over 10 years at this point. There's been a whole lot of supports and tools created to help people navigate that, to help people understand how much, different scenarios that could play out and how much your total cost of care could be in a year. And the education and the health literacy that have gone into that is still very much a work in progress. It is very complex. I think more tools and education are helpful, but I think it behooves policymakers to be thinking about ways to simplify that, because I don't think you shouldn't need an advanced degree in health policy to know how to use your healthcare plan.
Well, and I think even people with advanced degrees in health policy don't always know how to use their healthcare
Yeah.
plans. I mean, I always feel like, health insurance is confusing for everybody. It's just if you have an employer who provides your insurance, they do part of the work for you. People think that more choice is better, and in some cases maybe that's true, but these are not easy choices. And this is certainly when it's put directly and entirely into the laps of people who may or may not have the resources for whatever reason to make those choices. I think I'd like to think we've learned lessons there, but to your point,
Yeah.
we'll see if policymakers have learned lessons. I think probably insurers and navigators and brokers have learned quite a bit. So then let's come back to the topic of affordability and sort of in the moment that we're in now, on the heels of the OB3A, I guess is how we're calling it these days, formerly HR1, where we saw the expiration of those enhanced subsidies. And, as kind of one step among many that the current federal government is taking around how to deal with access and affordability. And it kind of seems like they're saying, like, okay, states, figure it out. We're not going to do this anymore. You guys are going to figure this out. So maybe talk a little bit about how and where this is working or not working, and how our states kind of filling the gaps there.
The enhanced tax credits really were a boon for marketplace enrollment. Not only did we see more people get covered, but we also saw an increase in enrollment in plans with richer benefits, people buying from bronze plans that have lower premium but much higher out-of-pocket costs, up to silver and gold, and even in some cases platinum plans, which cost more on a gross premium basis but have much lower deductibles and lower out-of-pocket expenses. The benefit of that is putting the actual cost of care in reach for many more consumers. So that's been really kind of broadly beneficial for a lot of people. It of course costs the taxpayer more money. These are premium tax credits, and in the debate of the last year around this, which led to the very long government shutdown, has been around, I think, those issues: access to healthcare, taxpayer dollars, some program integrity concerns. But ultimately, there was no deal forged and those subsidies expired. The impact of that has been very significant and real and is playing out throughout this year. Um, and we've already seen, our colleagues at Wakely put out a report, an early look at enrollment drops, and just in January alone, they identified that nationwide about 14% of people enrolled in January did not pay their premium. The impact is significant. To your point, is that it's not the same in every state. The money really certainly, the tax credits, the affordability investment really talks. It has a direct impact on enrollment, and there are several states like New Mexico who are trying to find state level funding to pay for premium subsidies to address the affordability gap. But the price tag is significant. I think it was CBO estimated it to be around $30 billion a year, the cost of extending those subsidies. And when you get down to the state level, most states cannot come up with the funds to backfill that. There are a select few states that are finding the funds through legislative efforts to identify premium subsidies, cost sharing subsidies. The impact is less bad in those states. In some states, it's positive, but in most states, it's blunting the impact of coverage losses. You mentioned OB3A, which I will do my best to remember to say that correctly. But you layer on the impact of that, which has a whole lot of reforms in both the Medicaid and the ACA space that are projected to have negative impacts on coverage levels. And I think you'll see both in the ACA space, but with work requirements and other reforms, community engagement / work requirements in the Medicaid space and other initiatives, you're going to see downward pressure on coverage levels. And I think the reforms, both in Medicaid and ACA marketplace, are going to result in the coverage gap getting bigger and in us seeing higher rates of uninsured across the country and more people showing up in emergency rooms with issues that they've delayed. And, the downstream impact of that is costs, higher rates of uncompensated care and more costs into the system.
Personal debt, et cetera. Yeah.
Mm-hmm.
So let me kind of come at this from a different angle. So I think we've established, the where the market doesn't work well for folks that are kind of in this zone of coverage that bounce around and are gonna lose those subsidies and therefore lose coverage. But we're also at an interesting time where employers are, the affordability issue is not just with ACA or employer coverage. If you're lucky enough to have it, you're paying a lot for it. And, with wages gaps and so forth being what they are, I've been following employers for a really long time. And I feel like for a really long time, we've been saying, oh, employers at some point are going to, want to do something differently. And it hasn't happened yet. I'm kind of wondering if it's going to happen now, if the affordability issues have just, reached a tipping point with everything else going on in the economy right now. Is this a time where you start to see some employers making big shifts, making big changes from the coverage that they've typically provided? Just, how are you, what are you seeing there that, do you agree? Or do you think that something could start to give there that might add more fuel to the fire of this affordability concern?
I think that framing is exactly right. I think for a long time, employer-sponsored coverage has been thought of as very, very, a positive benefit, and has been something that policymakers have, tried to avoid reforming. Employer-sponsored insurance tax exclusion is something like $300 billion a year. And I mentioned the cost of the enhanced premium tax credits being $30 billion a year. It's so much significantly more in terms of the cost to the taxpayer. It's been something that there was some reform included in the ACA. You may recall the Cadillac tax
Oh
that
yeah, the good old
um,
Cadillac tax.
the good old Cadillac tax on really rich benefit plans that would kick in and assess a fee on those rich plans over a certain amount of benefit, a certain amount of premium. That was delayed a couple of years and then eventually repealed. So, like you said, it's been something that policymakers generally have stayed away from, and even when they've, you know, dipped their toes in the water, have walked it back. Um, but like you said, affordability of employer coverage is not there anymore. There's a ton of data and stats showing that, the great growth of cost sharing for employer-based plans over the last 10, 15 years. And it is really a very similar story in terms of the difference between access to health insurance and access to health care, right? You can maybe afford your premium, but the ability to actually access the health care you need, given the very high deductible, given the very high out of pocket costs, puts the cost of healthcare out of reach. And so I think just like you said, there is less excitement about employer coverage than there once was. Um, and and I think that's ripe for reform. I think in particular, small group coverage has really, really taken a hit. And this is employers with 50 employees or less. Total enrollment was about 16.8 million in 2013. It's now down to 10.3 million in 2023, which is a nearly 40% decline in membership over a 10-year period. And the cost of health insurance, the cost of offering it, the cost of accessing it for the employees is a major driving factor there.
Well, and let's not forget the ACA certainly did have a plan for small group marketplace, which never got off the ground.
There's been a few select states that have been successful with shop exchanges, but by and large, it's not been something that ever took off.
We're in an interesting moment right now, the middle of 2026, heading into a midterm election. I think this administration has a unique and different approach to trying to make big things happen. Direct negotiating with pharmaceutical companies, for example, to try to extract, price concessions. This time of the year, you typically see bipartisan legislation, so everybody can go home and campaign, talking about the things that they've accomplished. I'm just wondering what you're observing, in DC, or if you have any sense of any policy scenarios that might come forth this year. For example, I keep hearing Republican talk about health savings accounts, and I feel like there's, again, that's something that's been around for a long time, maybe a little bit more traction than it has in the past, and thinking, maybe once upon a time had limited utility, but given these changes that you're also talking about around affordability, under what circumstances could something like this, be a tool? I mean, is there anything like that may be coming back around for consideration to be helpful here?
Yeah, there certainly has been a ton of talk about HSAs, including, I think the president has floated converting the premium tax credits, the subsidies through the marketplaces into HSAs. And the challenge with the knock on HSAs historically has been that they're not necessarily a tool for low income populations who just don't have disposable income to put into a tax deductible account. Would be nice to have one, but if you're struggling to make ends meet in terms of your rent and childcare and your health insurance premiums and groceries and transportation, what's the value of having a tax-free vehicle if I have nothing that I can invest in it? If I don't have the ability to invest in an HSA, it doesn't really do me much. So, and so that's kind of broadly commentary around HSAs. The idea of converting the premium tax credits to HSAs, the idea there has been very kind of skimpy on the details, so a little bit hard to evaluate that. I think my general sense is that it feels like a mechanism for investing less in affordability, in investing less in premium assistance, and therefore it's less of a reform and more of just a taxpayer cost cutting mechanism. So, but again, the details are not there on such proposals, and I certainly will evaluate them with an open mind when they come out.
So let's talk about uh, ICRA, which is the individual coverage health reimbursement arrangement model. So super wonky term. I never remember what it means, but I have it written in front of me. But talk about what that is. It seems like there's some excitement, at least among folks I know who know what they're talking about. They seem to get excited about this. So why should people be excited about this? What could this potentially do?
ICRAs are another type of account-based plan option. They specifically are for employers interested in contributing to the cost of health insurance and health care for their employees, but not interested in offering a traditional employer plan. An ICRA is specifically for buying plans on the individual market, which is where the ACA marketplaces operate. Um, and what this allows is for employers to contribute through that tax deductible, the employer sponsored insurance tax exclusion. So it's still
Okay.
tax free for the employer. It allows them to contribute to that account, and then it gives the employee the ability to go to the individual market and find the right plan for their health needs, their budget. It is a flavor of the shop idea, but through an HRA mechanism and not through the marketplace, or it doesn't have to be through the marketplace. There is a lot of interest in this in the context of the earlier conversation we had about how hard it is to maintain costs and affordability through traditional employer insurance. And what this is more portability for the consumer, the ability for the employer to still offer an health insurance like benefit, which is a very important thing in terms of overall compensation packages. It still preserves the tax deductibility of that employer contribution for the employer, and in some cases allows the employees to have access to more affordable options, and certainly allows them to shop around for a specific health plan for their needs. It's been slow on the uptake in terms of interest and enrollment in the last couple of years. Like you said, there's been a ton of excitement and interest in this. I certainly see the value. I think the kind of the idea of portability and getting away from being tied to your employer plan, or to one plan that fits all is attractive to consumers. Um, it's still kind of in its infancy. It also very importantly requires an individual market that is stable, and lasting. And unfortunately for ICRA, we're not in a period of certainty for the future around the ACA, the individual market, and that has real impacts on stability and importantly premiums. Right, for this to be an affordable option, premiums cannot skyrocket. The individual market has seen really, really bad. I think it was on average from 25 to 26, a 25% premium increase. Um, we're in a period of instability for the individual market, and that makes the attractiveness of ICRA as an option harder.
Why has it been slow getting off the ground?
It's complicated. I
Mm.
mean, the name itself, right? Individual coverage, health reimbursement arrangements. Not really about the name, but it's kind of a symbol for the complicated nature of it. For kind of operators in this space, it's a different way of delivering employer benefits. And importantly, most employer benefits are delivered through a distribution model that includes a health insurance broker. And just think about the insurance broker. You can sell one kind of policy for a group of 100. The administrative work associated with that is X. If you go to an ICRA, then it's 100 different policies for each individual member. And in some cases, the broker commission structure themselves is much different and could be lower. And the level of effort for that broker and the return on that investment of their time is Y, and could be significantly more. If most health plan enrollments are through brokers, you need the brokers on board. And I think there's a faction of the broker community that is warming up, but it is still not something that is widespread and seen as like a critical piece of the overall employer benefits portfolio. So that's just a
So
piece
it's,
of it. There's other complicated things
yeah.
associated with it, but that's a big part of it.
I didn't realize. So they're still trying to keep it with the brokers. So the brokers aren't going to lose the business. They're just going to get it differently.
Importantly, in the individual market, brokers play such an important role. Brokers do the bulk of the individual market enrollment assistance and plans and are the only ones who can give advice legally on the right plan. And so they play a huge role in the employer space, but they play, you know, a
Mm.
very significant role in the individual space. And there are vendors that are spinning up with ICRA that are doing decision support, but I don't know that the successful ones are going to be able to navigate that space without very direct partnerships with the broker community.
We know all of this is complicated. We know healthcare is complicated. This particular segment of the market seems to be even more complicated, right? Because if it wasn't working before, there were lots of reasons for that. Um, Let me ask you, if you had a magic wand, given everything you know and have experienced in this market for as long as you've been involved, if you had a magic wand and you could shape coverage, let's say 10 years from now, what changes would you make today to make sure that we get it right this time? That that I guess maybe the ACA market, but maybe your magic wand would do something different. But so that we can kind of reverse these negative trends and get to a more stable place in this market.
Well, there is the bazillion dollar question, right? I think, I don't, first thing I'll say is it's not one thing. I think, but if I,
You only get one magic wand, though. So,
yeah, but I mean, I think the first thing I would do is try and do what I can um, to make it a little simpler for consumers. The amount, we talked about coverage transitions to the extent that we could simplify that and ensure there are less of them. Um, that would go a long way towards continuity of access and continuity of coverage. And so, like we talked about the small group market being in dire straits. One solution would be to transition people in, consumers who work for employers with 50 employees or less to just no longer be in the business of offering health insurance and move those members over to the individual market. That would make the individual market a little bigger. It would make the viability and stability of the marketplaces bigger, and it would kind of solve for the question of small employers trying to figure out how to offer affordable health insurance benefits to their employees. A couple other things I would do is do something about the tax exclusion for employer-sponsored insurance. Maybe not do
I
away
was
with
going to
it,
say, do
but
something about
yeah,
what can be done.
yeah. Well, I mean, the Cadillac tax from the ACA is an example, right? Put a
Mhm.
cap on it where above a certain generosity, you have to start contributing. Um, I think a more aggressive thing is just to do away with it, and that seems. I try to be a pragmatist. That seems very unlikely. So I think trying to cap that, maybe bring back some version of the Cadillac tax would go a long way towards generating revenue, and that can be invested in affordability and access. And then the last thing I think I'd throw out there is um, there is a barrier to access to the subsidies through the marketplace, through the ACA marketplaces, around whether or not you have access to affordable, quote unquote, affordable coverage through some other means, including employer coverage. I think a way to improve the portability and choice of health insurance is to get rid of that requirement on the employer coverage side. Allow people to enroll in their employer plan if they want to, but if they want to go to the marketplace and get subsidies based on their household income, give them the ability to do so and don't shut them out because they have access to employer coverage.
All right, I'll give you the three. Those are all I could see how they're all interrelated. Maybe I'll just ask you one last question. Because it's interesting that in the conversation, and I sort of alluded to it. There was a lot that the ACA intended to do that would have been more transformative. Some of the things didn't come to fruition for a whole bunch of reasons. But if you maybe either could go back in time and write the ACA differently, what would you have done differently in that legislation and that plan and that program to make it more successful?
I would have written the coverage continuum for the expansion population to the individual market, with subsidies through the marketplaces differently. In a lot of ways, the kind of from Medicaid to marketplace is a coverage continuum that based on your income, you're in a different program, but um, it doesn't really that's what the federal rules, that's what the federal law says. But for the consumer, for the family, those eligibility distinctions are really not that important, and but are have significant consequences on access, particularly if you have fluctuating income or your family size changes. You can find yourself one day on Medicaid, the next day on marketplace, and moving back and forth. It is truly an eligibility coverage continuum, and I would have just made it simpler. Just one set of eligibility standards, maybe for Medicaid. If you don't want to call it that, call it something else, call it marketplace coverage, but just make it so families who don't have the access to affordable employer coverage or something else have an ability to apply for and enroll in coverage simply through one program instead of two.
Yeah.
Certainly doable. I think that the stigma associated with Medicaid coverage has come a long way and is less of a fraught thing. So certainly think it's possible if the right policymakers and leaders get together on it.
One can hope. One can hope. Well, thank you for all the work you do. Thank you for the conversation today. And we'll stay tuned because there will be more twists and turns in the Affordable Care Act marketplace because there have been plenty and there are more to come. So we'll come back to you when there's more news to break.
All right, Jen, thanks so much for having me on.
Thank you very much. This episode of Vital Viewpoints on Healthcare is sponsored by HMA Information Services. HMAIS is a subscription-based service that provides state-level data on publicly sponsored programs like Medicaid. From the latest managed care enrollment, market share, and financial performance data to up-to-date RFP calendars and state-by-state overviews, HMAIS has all the information you'll need to power your initiatives to success. This podcast was produced by myself, Jennifer Colomonico, along with Tiffany McKenzie, in collaboration with our guests. The content is the property of Health Management Associates.